morning. It is Tuesday, July 20th. I'm Jessica Lovell. Welcome into the morning medical update. Coming up today, as COVID cases rise, we will break down the new recommendations for fall sports here in Kansas. Plus, how school nurses are working to get ready for the upcoming school year. We'll get to all of that, but first, as always, let's get straight to the numbers. Dr. Nathan Barr joining us in for Dr. Hawkinson with our COVID count. Good morning. Welcome.
Good morning. Hospital's still quite busy. There are 33 active cases today, 9 of those in the ICU. 5 of those ICU patients are needing a ventilator to help them breathe. We have 55 total patients today. That's really just about the same as yesterday. So it's still a very busy hospital. A lot of people very sick with COVID. In Hays, we have 5 active inpatients today.
All right, thank you for that update. Before we get to our reporter questions today, I do want to go ahead and introduce our guest panel because folks may have some questions for them. Dr. David Smith, who sits on the Kansas State High School Activities Association Sports Medicine Advisory Committee, say all that real fast, along with school nurse Shelby Rebeck. She is the Director of Health Services for the Shawnee Mission School District. So welcome in to both of you. I want to see if we have any reporter questions on the line. Okay, jump in if you have one. I do have one from Donna at KMBZ. She's asked, the American Academy of Pediatrics recommends children wear masks when going back to school. This just came out yesterday, and this is regardless of vaccination status. The CDC is not going that far just yet. It recommends only unvaccinated people to wear masks. What do you say? Shelby, I'm going to go ahead and start with you. What are your thoughts?
Well, I just finished reading the guidelines yesterday, so obviously still digesting and processing, but they mentioned the goal of keeping students safe and physically in school. We all know that masking works. However, we also know the challenge to that is that, about 50% of our parents don't want their children masked this school year. So we definitely have our work cut out for us to figure out what the best path forward is.
Dr. Barr, your thoughts?
To be honest, I think it's a really good, good recommendation. I'm excited about it. I think it's going to help prevent COVID spread. So logistically, totally get it. And that's going to be a challenge. Unfortunately, there is resistance to wanting to wear a mask, but it's the right thing for our kids to keep them safe. And man, I'm happy to hear that recommendation, and I hope it's more widespread in the near future.
Dr. Smith, how will that impact sports?
I read through those recommendations too, and I'll weigh in more on the sports aspect because last year, as we observed athletes trying to be safe, mask, wash, stay home if sick, what I observed was the improper use of masks was commonplace. So when I say mask, I say properly. I did not see hardly any athletes and coaches masking exactly like we do in the hospital. And so my concern when the Academy comes out with that, I respect the Academy of Pediatrics, but a 2-year-old and above, the young children, I have not observed a child in school, but I can't imagine if the adults can't do it, how can the children do it? So I really have concerns about that. On the athletic field, what I see is we're trying to keep them hydrated, nourished, keep them in little small groups, but they're handling their face all the time, moving their mask down to drink, moving it back up. Watch the TV, you'll see a coach scream at his players with his mask down and then pull it back up while he stands alone. It's completely the opposite. So I struggle with it. It's going to be, Shelby, I give you kudos. You're going to work hard this year again, just like you and your nurses last year. But we'll see how it will roll out. And remember, it's just a recommendation from one organization.
Yeah, and I think that's exactly right. It does matter so much that you do it correctly, but I'll tell you this. I have a 4-year-old and a not quite 2-year-old, and they're able to do it. Now this is one-on-one parenting. It's a different situation. It's a lot easier. I can give them a lot more direction, but they don't have a problem doing it if they're prompted how to do it correctly. So, I think buy-in is really important, and I think hopefully, parents will buy in on this a bit more too. It's all about keeping them safe. This is the only reason behind this. So I hope parents will understand that and try to help their kids learn how to do it right. And then, authority figures like coaches, if they're doing the right thing, that's going to help a lot too. The example, you're right. You see this in the pro coaching ranks all the time too, right? They yank their mask down, they scream, and you see literally the droplets go as they scream, and you're like, Oh no. So good modeling would be the way to go, but it can be done. It requires a lot of buy-in.
Yeah, Dr. Barr, don't underestimate, right, the young kids. I have young kids myself, and they wear their mask like a badge of honor. They know that they're doing it right. They always call it the virus, and when the COVID is over, can we take our masks off? But they are ready and willing to do what they have to do. I think you just got to give kids the chance to do it, right?
Mine are excited about it. They really get excited about it.
Yeah, right? Shelby, I have to ask you, though, for the American Academy of Pediatrics recommendation, what does that mean, though, for school districts? Is it a state thing? Is that something that school districts can adopt? How does that work?
I think, as Dr. Smith said, it's a recommendation from one entity. We need to look at recommendations from all of our health entities, the CDC, KDHE, Johnson County, things that are going on nationwide, or even things that are going on in Western Kansas may not pertain to Johnson County and what's going on here. So all of your Kansas school nurses right now, they're working to figure out what is best for my district.
Okay. Any other reporter questions right now? Nothing? Okay.
Yeah,
Jump right in.
hello? Yeah, hi, John Shorman with the KC Star. I was kind of curious, given that we have now these recommendations from both CDC and AAP, how do you approach the question of quarantining for potentially exposed students, especially in those older grades where you're going to have a population of vaccinated children and also unvaccinated children? And is it going to be tricky to differentiate between the two and kind of have potentially different policies regarding quarantine for those two populations, or do you plan to treat all those students the same?
Fortunately, here in Johnson County, our county health department has given the schools guidelines, so we know exactly what we're going to do when we have an exposure to a positive case of COVID. Those who are vaccinated, as long as they are asymptomatic, will be able to remain in school. Unvaccinated, the county health department will be quarantining those individuals.
All right, Josh, thanks for your question. Dr. Smith, let's get to the other top story right now, the Olympics and our local gymnast who is an alternate on the U.S. women's gymnastics team. She tested positive for COVID. She's going to be quarantined now for 10 days. Your thoughts?
First of all, it's very unfortunate when you think about the training that these elite athletes go through, and they've already been delayed 1 year from last year's Olympics being canceled to this year. And this year's Olympics is going to look a lot different with no spectators in the stands and obviously extreme caution and risk mitigation strategies that are being implemented and frequent testing. But the concern I have is, it was Kara Eaker, excellent gymnast, an alternate on the team, and she was vaccinated, and yet she still was tested positive, whereas the other, Leanne Wong, was not vaccinated, and of course she's been around the gymnasts, including her teammate Kara. And so that means that, unfortunately, Leanne has to go into quarantine, too, because of the possible exposure. Now, I don't know the details. I speak as one that just sees what you see in the news. And yet I know that that's got to be really anxiety-provoking for that team. The media is picking up on it. And I know before, when Leanne had chosen, along with her parents' guidance, to not get the vaccine, she was really picked on, like she was throwing caution to the wind. I can tell you, these athletes, I've been around elite athletes all my career, and they are extremely, extremely careful. None of them want to test positive over there because they know what the ramifications are. None of them want their teammates to get COVID, so they're being extremely cautious. So it's unfortunate that it happens right before the Olympics start. But this will not be the first case there's going to be, or the last case. There's going to be more cases. And I know that the team that takes care of those athletes are very excellent physicians, athletic trainers, physical therapists, chiropractors, massage therapists, nutritionists. I've been around U.S. gymnastics because we had the national championship here in town a couple years ago, and I saw how this works. So I think that the message is, let's still be a proponent of vaccination. But that message also can be, even if you're vaccinated, it doesn't make you immune to the possibility of picking up the virus. We still need to consider all the other risk mitigation strategies as we get back into fall sports.
I know our community has a lot of great questions for our entire panel, so I just want to rip through a few questions for them really quick. So be thinking of those and get those sent in to Jill. Dr. Smith, you just had your advisory committee meeting. What is the latest recommendations for fall sports? What did you guys find out?
Yeah, we just met last week, and so this information this week obviously is new, but it doesn't change what our recommendations as an advisory committee. We really lean heavily on the CDC, the KDHE, and the county health departments. You know, across the state of Kansas, every county is a little bit different. I did hear the number that just over 40% of Kansans are fully vaccinated. Yet, if you look at the 12 to 18 age group, only about 30% are vaccinated. Those are the athletes that we primarily deal with in our youth sports medicine program here at the University of Kansas Health System. And so 30% is not much, and yet we want to continue to advise, get your vaccination. My concern is probably greater that whether you're vaccinated or not, and you're going back to youth sports, what happens if you become ill? Well, what should happen is you should stay home and report that illness and go through the proper channels to have it evaluated. I'm hearing stories about parents and children, they don't want to take them to the doctor because they just don't want to know, because they don't want to be that index case that shuts down a team. And I find that really disheartening. I think that I've always been a proponent of, let's get sports going, but let's keep it going. It's not just opening, it's keeping it going. And there's so many things we can do to protect one another. We're a team. This is a team of young people that want to get back out on the field. So how can we do that? Have a team strategy. No different than your coach sets up a strategy for winning a game. If we want to win this game, we've got to work together as a team, and that's brutal honesty, really, and then working through with your healthcare professionals on the appropriate testing and treatment.
All right, so what are the conversations right now as we're kind of 4 to 5 weeks out? What are those conversations right now with your teams and the group of professionals, and what might be different from this time last year?
Yeah. Well, first of all, athletes need to have a sports physical before they start. That's a great base. When you go in to get your doctor to clear you for sports, they're going to ask you about everything, not just COVID, but about whether you've had concussion, heart questions and things that are all very important. Those that have had COVID in the past year, there should be specific questions their physician asks them about return to sports. Those that have not had COVID, then obviously the vaccination status is important for their physician to ask them about. Nobody's mandating vaccination to get back on the youth sports field. Again, we're strongly advising that as an advisory committee. And yet we will continue to watch our experts through the KDHE and through the CDC. And Shelby hit it on the head. The Academy of Pediatrics came up with their recommendation yesterday. That's not policy, it's recommendation. Now let's see, does the CDC do something a little bit differently as we enter the school season? But we're saying sports is heading forward. We are going to have fall youth sports. Are we going to be able to keep it going? I sure hope so. If we all work together, we will keep it going. We proved that last year with fall sports. And then I like to say, if you look at wrestling in the winter, an indoor sport, high risk, close face-to-face contact, really. They were on the mat without masks. They were masked before they got on the mat. They were masked after they got off the mat. But we had very, very, very few cases through wrestling, which I thought was quite interesting, how you could possibly not have huge spread in a sport like that. And football, same thing. That's pretty close contact, and yet we just didn't have many. Yes, there were reports on teams citywide, nationwide, that had to shut down and be quarantined. And I also heard reports of athletes that were going to the field sick, not wanting to report their illness for fear that they'd shut down their team. Please, my message to youth athletes is don't do that. We're here to help you play sports.
Yeah, get rid of that stigma.
Right.
Real quick. Okay, Shelby, I want to bring you in here real quick. What is the percentage of kids vaccinated in the district right now?
Unfortunately, we are about 30% for our highest zip codes within Shawnee Mission School District, and then 20% for the remaining, for that 12 to 17 or 18-year-old group.
That has to be very concerning to you.
Obviously, yes. And, we really want our kids to get vaccinated. That is our number one. American Academy of Pediatrics and all of the other entities agree with that. Vaccination is our number one way to keep our kids healthy.
I was going to ask you what the biggest challenge is heading into the school year. I think you just answered it, trying to get people vaccinated. But what are your discussions like right now? What did you do last year that's helping you prepare for this year, and how is it different?
Well, we learned so much last year, so now we know that vaccinations work. We learned last year that masking really works. We learned that cohorting and social distancing and personal hand hygiene and, ventilation, we learned all of those things, being outdoors. So now the challenge this year is to get rid of the misinformation that's out there, get rid of the myths about masking and the myths about the vaccination, and really to have our school nurses focus in on how do we help our kids stay in school to learn, and then also stay in school to participate in their athletic events, which we know are so important to them.
Would you like to see all kids masked starting this school year?
I honestly, personally, I wrestle with that decision back and forth. Yes, I know it's the safest thing. As a nurse, I know that is the safest thing for our kids and probably the best way to keep everybody in school. But do I put that on our teachers and our principals and our school nurses and the people who have to police that in the building, knowing that 50% of our district does not want that? I'm not sure. You know, those people are in those schools to educate and to, you know, kind of put them as the police of masking. I don't know that that's the right thing either. So it's an internal struggle. I don't have an answer for you.
Okay, let me ask you this. So I'm a parent, and I'm going to ask on behalf of all parents out there, what can we do to help you this year?
You know, I think all the school districts will be making decisions that their boards of education have thought long and hard about, and they have come up with something that they feel is right for their community. So I think supporting those decisions, it may not be the right thing for you or your family, but recognizing the greater good, recognizing that we want to keep kids in school. That is all. Everybody can agree on that. So in order to do that, please comply with whatever your Board of Education decides. Be kind about it. You know, when your school nurse calls to say, hey, someone has tested positive, or when the county health department calls to say, hey, someone needs a quarantine, follow those guidelines. Don't make us the people who have to police that at school and really waste our time not educating kids by having to police all these issues.
All right, we're going to help you by trying to do our part in the home. Okay, so Jill, I know our community, as always, has great questions. They're rolling in. Let's get after it.
It feels like we're backsliding. And she wants to know, with the restrictions on masks lifted, will we see flu and RSV in the fall? Because last year, our doctors were saying masks are really helping to hold that down. How will everyone deal with Delta, flu, RSV?
We're already seeing it. In regards to RSV, you know, RSV is I think a lot of pediatricians are concerned that we're seeing sort of an abnormal time of year for RSV to be upticking. So that's happening, and I think without a doubt it's because of the lifting of these masking regulations. So that's happening, and yeah, I have no doubt when we remove some of these barriers, we're going to see more of the other two. And I can tell you, just seeing hospitalized patients right now, we're seeing all kinds of respiratory viruses, and the numbers were down for a number of them, really down, as I think most folks are aware of. So yeah, I think we'll see it. I think we are seeing some of it, and if the masking recommendations don't come back, I'm sure we will continue to see it.
And Trudy asks, with the Delta virus showing up as sneezing and sore throats and coughing, how will school nurses be able to distinguish between, oh, that kid's just got the sniffles, or I need to send him home to get a COVID test? How are you going to navigate all that?
Well, again, fortunately, here in Johnson County, our health department has given us guidelines and exclusion criteria. So if you have one of the primary symptoms or two of the secondary symptoms, we will be excluding you from school for COVID-like illness and asking you to either get an alternate diagnosis from your physician or a test, a PCR test, or to stay home for the 10 days.
That's the challenge, right? I mean, I think that's probably, it's very helpful that you have guidelines, because that will help you navigate it. But yeah, a lot of respiratory viral illnesses can start off in a similar type of way, and so it is a bit tricky to do that, and it's helpful to have guidance to do that. But I think as I did with my young kid very recently, he had a fever of 102. He went and got a COVID test. That was the answer. Now that's not what he has, and that's great. But I think for me as a parent, that's the easiest answer. Is if I think they could have COVID, I'm going to get them checked.
One of the things that I struggle with is the accessibility to providers to be tested or to be treated or to discuss vaccination. You know, there are communities where the parents are not taking their children to the doctor very often, or it's too costly. You know, we had that great program of free testing throughout the state of Kansas that was very helpful. I mean, I had to do it before I left town, and it was easy. I just showed up in a church parking lot. I did the spit test, as we call it, and I had the results back within a day. And it was very reassuring to me. But we need that accessibility of testing. And as I said earlier, a lot of people don't want to get tested because they just don't want to know. They don't want to be that person then that has to stay out for 10 days, whether it's an athlete or a non-athlete. So, and I would challenge our whole system throughout the state as to how we can make this even more accessible. I understand there's plenty of vaccinations, so that shouldn't be a reason. In fact, we have a school that we contract with to provide athletic training services, and the University of Kansas Health System went out and helped them vaccinate just a week or two ago. The turnout was not great. Here's an example of you can get a free vaccination. We're setting it up at your school. You know how to get there. Why aren't they coming over and getting that vaccination? So we need to make that lower the myths, as I think Shelby said earlier, and let's all work together again on how to make this easy to do.
Yeah, it's easier to get a vaccination than it is to get a test.
Exactly. That's part of the problem right now.
Brenda says, should student athletes be doing spit tests or some kind of COVID test before they play like the pro athletes do and like our Olympians are doing?
Logistically, that's impossible when you think about the thousands of athletes throughout the state of Kansas in different counties. You know, as we move up the ladder to elite level athletes, obviously the NFL, money's no object when it comes to testing, right? Major League Baseball or the USOC. And it's just one of the high profile things that we can do at that level. But to trickle that down to the rest of us, and I'll include myself as common folk throughout the state, that is something we discussed in our Sports Medicine Advisory Committee. We are not making that as a recommendation that we try to do testing. Part of the problem with testing, too, is you'd have to literally test these athletes every other day, because a negative test and an exposure 2 to 3 days later could be a positive case. And correct me if I'm wrong on that, Dr. Barr, but that is something that would be logistically impossible. And then what test? You know, some would try to find the cheapest test to save, their budget. So we're not recommending testing. Obviously, Shelby hit it on the head. The counties have their guidelines in what they do, and the testing, the contact tracing, the quarantining, the isolating, and we must really, I like the comment you made too, Shelby, is let's work together. Let's be kind. Why can't we be kind? I don't understand why this has to be put your fists up and put your gloves on and let's duke it out just because your opinion is different than mine. Aren't we all in this together? It's that team concept I continue to try to preach.
Sam,
I will add that KDHE, they did come out with funding for school districts for K through 12 vaccinations and testing. So our district will be pursuing that, and we have a great partner in Mod Laboratories, and they will be offering surveillance testing. It's optional, but
Excellent.
to any athlete who wants that. So we will we'll do our best.
Is that going to be at the school, at your school, Shelby, or they have to go to a testing site?
Well, right now we think it's going to be at the school during their school day when all the other students who are offered surveillance testing and teachers as well will be offered that.
Easy accessibility makes all the difference in the world. And then free. Nobody wants to put out money to do some of this. So, and I understand that.
Sam is asking, Dr. Smith, are you seeing any students who had COVID over the course of the pandemic? And if yes, are they having any problems? What are you treating them for?
Yeah, you know what? We've been very fortunate. I know there was the big heart concern with COVID, and now we have an ongoing, not we personally, but KU, the University of KU in Lawrence is participating in a nationwide study with other universities on what happens to athletes that test positive. So they're doing extensive heart testing, and if you look at the preliminary data, it's exceedingly low how many have any heart issues afterwards. And as I say, this is the most studied virus ever when it comes to myocarditis and some of the effects from the virus. And again, Dr. Barr is the expert on it. However, Look at mono, very common in young folks. Look at influenza. Look at other viruses. All of them have a risk. Myocarditis is not new to me. I mean, we had a report. In fact, there was a KU swimmer years ago that died from myocarditis, many years ago, well in advance of COVID. I don't even know if they determined which virus it was, but it is a risk of any illness. Another reason, if you're ill, especially if you're ill with a fever, do not try to exercise and participate. Your risk goes up for contracting heart issues. But no, back to the question, it's been really nice. People have gotten COVID, they've cleared. Yes, we had a case, one of our athletes at one of the schools we contract with, that had the multi-system inflammatory syndrome and was very ill for almost 2 weeks in our hospital here, fully recovered, back on the field. I mean, he's doing great. However, that's a concern. That is one of the problems we can see with this particular virus. And so the uptick, I get discouraged when I hear RSV is going back up. You know, influenza is going to come back this winter. We're going to have other illnesses. And that is a concern a lot of people have. Well, if I'm going to get vaccinated, I'm going to be careful. Does this mean I'm going to mask the rest of my life? They're very, very worried about that. Illnesses are not going away. We just need, I think this has been the silver lining in this pandemic. How can we do so many things to prevent any illness? Whether it's staph infections on the skin, herpes infections in wrestlers on the skin, viral infections, other just general colds and so forth. There's so much we can do. Cleanliness, skin hygiene, cover your cough when you sneeze or cough, wash your hands, gel your hands. So many things that we all ought to be doing routinely.
So if I could just mention real quick, myocarditis is rare in COVID. It's much more common from COVID than it is from the COVID vaccinations. So I just want to make that exceedingly clear. That's a concern that's out there. There is a slightly increased risk with COVID vaccination and getting myocarditis from if none of this happened. But if you compare COVID versus the COVID vaccination, much higher risk getting COVID for myocarditis.
That's a great point, because that has been the vaccine hesitancy many times as the concern with the heart. Thank you.
Sally asks, will kids be protected from COVID in elementary school if they wear a mask, but their classmate doesn't?
What I would say is it would be best if everybody's on the same plan there, right? I mean, wearing a mask myself helps protect me. It is not foolproof, particularly if it's, the cloth mask. This discussion, I'm sure, has been had many times. If everybody's wearing a mask, it's dropping that risk really well. So it all depends on the situation, right? If it's a school district that's saying everybody's going to wear a mask, okay, that takes care of it. If it is a situation where it's, well, we're hoping everybody will do it, and then we're going to run into where, parents aren't wanting it to happen, and then, yeah, you can't do everything possible to protect your kid in that circumstance. So it's sort of a, it is best from a risk mitigation perspective if everybody's doing it.
I use the sports analogy. I'm such a sports nut. Think about a team, a football team, the Kansas City Chiefs. What if Travis Kelce says, "No, coach, I want to go down this area of the end zone," and Patrick Mahomes expects him to be on the other side of the field, and he says, "No, I just don't want to do it." Well, come on, we've got a coordinated effort here to win this game. Let's work together. So I think that sports analogy, that's what I try to preach to the kids on the field. Why do you want to be out there on your island by yourself? Don't you want to follow the game plan so you can win this game? So it's kind of a stupid sports analogy, but I like to use it.
I think it hits home for sure. Definitely. Okay, and, Shelby, what's your thoughts? My daughter will be masking starting out the school year. I know that. She's 8 years old. My 5-year-old's going into school for the first time. He wants to do like Big Sister, so he'll be wearing his mask. But what are your thoughts?
Yeah, our county has said both parties need to be masked appropriately in order for them not to quarantine if there's a positive case. So we really would want both parties to be masked in order to not miss out on learning opportunities.
So does that mean that then the masking doesn't really matter? You'll be quarantined no matter what? Even if you're wearing one, you're going to still be quarantined?
Yeah, if you're exposed to a positive case who is not wearing a mask and, you're within that 6 feet, and when the county does their contact tracing, if they find, yes, that person, even though they're wearing a mask, would be quarantined.
Oy, that's discouraging.
But it's going to increase, or it's going to decrease
Yes.
the risk for that person, right? Yeah. So there is the practice, the quarantining is, I get it, not ideal.
That's frustrating, yes.
It's frustrating, but it is gonna help them decrease their risk. So even if the other person isn't, definitely wearing a mask yourself is better than not.
Jill and Lindsay and some others are wanting to know, can you please tell us how many of your patients are vaccinated and how many are not? Well, before the doctor answers, I want to let the audience know that in the community that those numbers have to be hand-pulled by a manager. And as the number of patients go up, that task becomes even more time-intensive. But we have committed to doing it at least a couple of times a week, and so we're going to try to get that added information. But right now, Dr. Barr, do you have any knowledge of how many are breakthrough infections versus just unvaccinated?
I mean, of the patients in the hospital, these are far and away unvaccinated patients. To get hospitalized with COVID at this point, there's essentially two situations happening for the most part. By far the most common is that they're unvaccinated, and some of those are getting quite sick. And then the other is folks that are vaccinated but have immune suppression of some type, some pre-existing condition, where the vaccine isn't as effective in those people. And that's true for COVID vaccines or any vaccine. If you think about how a vaccine works, it helps your immune system build a response. If your immune system starts off weaker, not able to make that big response, then the vaccine just can't be as effective. So that's what we're seeing. And it's, just another, we have as I said to start the day, we have a lot of sick people with COVID, and the vast majority of these folks are completely unvaccinated, and the remainder are people that essentially have conditions that make the vaccine less effective for them. So if you're looking out for your risk, get vaccinated right away. And I guess I'm just going to take the chance right now to rant a little bit.
Go for it.
If it's not just ourselves too, right? We're talking about this sort of team concept, and I would say, remember, this is not just about our own risk. This is about our neighbor's risk, our loved one's risk, and somebody we've never met's risk, right? And we should care about all those people. And so us getting vaccinated helps protect all those people. If you have an elderly parent with a couple of different medical conditions that's fully vaccinated and you're not vaccinated and you're seeing them, that's a risk for your elderly parent. So I would encourage everybody, think about yourself, but also think about everyone you love and care about, and just your community in general, because this is something where healthcare systems are really strapped trying to deal with this right now, around the region and broader as well. We really got to think about the whole community.
Ann wants to know, is there still a lack of reporting positive COVID cases in the news? I think the question might be better is there a lack of testing? Because I think the news agencies do a pretty good job of trying to report whatever numbers are out there.
Yeah, I mean, there's a few components to this. I think one of them is how accessible is the test, right? And that's one piece of it. And then the other is sort of the whatever. I have a sniffle. I'm not going to get tested. This sort of thing. Not wanting to deal with the consequences of the test. We definitely are seeing people that the first time they're presenting for a COVID test is in the emergency room, getting oxygen strapped onto their face. So clearly they've had symptoms for a while, have been feeling ill, and haven't gotten a test. Whether that's because it's hard to get or they've made the choice not to do it. Every circumstance is different. But yeah, it's definitely affecting the numbers we're seeing.
Dr. Smith, that's a concern you always talk about.
Yeah, that's definitely a concern, is how many are getting tested. We just don't know. We're kind of shooting in the dark. Once they get tested, those numbers can be accessed, but it's just, I don't know if we can believe the numbers right now, but we do know when you see the numbers go up in the hospital over the last 2 weeks, tripled, quadrupled?
Yeah.
That is very concerning, obviously, and these are sick people. My question then back to Dr. Barr is the one that I get asked, well, hold it, I had COVID last year. I'm not going to get the vaccine. Don't I have some immunity? And we talk about antibodies and T-cell, and I know that's been addressed, but I would like that addressed again here as we start sports. I get asked that question. Well, I don't need the vaccine. I was sick, whole family's sick, so I'm protected, right? Yeah. Dr. Barr?
Yeah, and I would just say the one really good thing with one of the really good things with these vaccinations is that they are producing responses that seem to be able to adapt fairly well to variants, and so that's the big advantage in my mind, is that there's that adaptability where, even as we've been through a lot of variants now, and the vaccines are still performing really well to them. It's not clear that natural infection is doing as well with that kind of a situation. So even if you had it, back a year ago, I would be doing it. It's the safest way to make sure you're protected.
Tanya wants to know if the symptoms for COVID are the same if you're vaccinated. She's got a runny nose, she's a little sneezy, she's got drainage. She doesn't want to give COVID to other people. Should she get tested, or is it just allergies?
Get tested. Yeah. It's the symptoms usually, it is much less severe, right? And so the symptoms may be the same, but wimpier versions, right? So it may be, instead of sort of awful congestion, fever kind of thing, it might be just sort of like, I don't know, I can't really tell if I have a fever. Oh, I guess it's 99. And I have a runny nose. And that may be all it is if you're vaccinated. Great news for you. Still get tested. Still try to avoid exposing other people. So it's harder because it does. I can tell you from personal experience with me and my family. I mean, it is a little like you don't want to constantly be thinking you need to run and get a test. But if you got symptoms that are compatible, the safest thing to do is to test.
And Pamela, she's a long hauler, and she said she's so frustrated and full of anxiety because people keep saying masking doesn't work. It's been proven it doesn't work. She said, if that's true, where is that study?
That's nonsense. It does work. There was a study actually that got published that suggested that perhaps masking does not work, and that has just been retracted very publicly because it was proven to be untrue. So perhaps that's where it's coming from, but there's also a lot of sort of just word of mouth or sharing on social media, et cetera, of sort of nonsense stories. And the truth is masking works, and those folks that are saying that it does not are misinformed. And so I totally get your frustration. Maybe you can tell. But it's you're right on. Keep fighting the good fight and telling them that it does work.
Isaac wants to know, how safe is it being at a local aquatic center? I think they should be good, and I think there's more than one viewer that wants to know that. Is that all right? It's outside.
Yeah, I'll answer that question because indoor-outdoor, there's indoor aquatic center, which increases the risk. I actually do some swimming for fitness, and I have no concern whatsoever if I have my own lane and I'm swimming indoors. Now, I am fully vaccinated. That gives me some peace, but as I just said, that doesn't guarantee I can't contract it. You obviously can't mask when you're swimming. Once a mask gets wet, it becomes ineffective. So an aquatic center, I picture some that have a few people at it, like a neighborhood pool, and I picture some that are packed. If I went to an aquatic center and it's packed, I'm not going to probably want to stay there very long. I want to keep my distance. I don't want to sound like I'm antisocial, but really, unless I know someone really well, I don't want to be closer than 6 feet from them. My friends, my family are the 6 feeters, and everybody else I'd like to be a little bit of distance from. So, and that's pre-COVID. I just don't like to be in someone's space.
Okay, Melissa is asking questions about kids and vaccines. Please know that Jess is Thursday, right? The Dr. Pahud is on with Dr. Lauer. And Dr. Pahud is from Children's Mercy. So if you have questions about kids and vaccines, you want to make sure you watch on Thursday. Time for just one or two more questions. Heather, Dr. Smith, is curious about the data around myocarditis. Where's it coming from? Because like adults, tests are coming up in long COVID adults and children as normal, even though their symptoms are far from it.
Yeah, I reported on that one that's the large multi-center athletic study looking at collegiate athletes. Obviously, you can't extrapolate all the information down to children, nor can you take it up to the older folks. One of the original studies was a wide variety of ages. And that one was really criticized because it was not very well controlled. I actually pulled a study on influenza many years ago, pre-COVID, and influenza had a high percentage of those that had evidence of myocarditis. You know, if you think about it, I had mono back when I was in medical school, and I remember recovering from it and deciding I'd start exercising, hopped on my bike and barely got around the block. I was so short of breath and tired. Was that some myocarditis? I don't know. I didn't go to the doctor and get it tested. So there are a lot of studies out there. Remember, a study that's out there doesn't always mean a good study. Dr. Barr just talked about one that was retracted. I saw one that was retracted too. They get out there, they don't get the full peer review, they suddenly get in a journal, and then people say, oh, it's in the journal of whatever, that's got to be a good study. There's a lot of studies in journals that are not good studies. And that's a little bit beyond my expertise. I really like to look at someone that is a research guru, looking over how they gather their statistics, how they did the study design, how they interpret the data. That's what peer review is all about. And I guarantee you social media is not a peer-reviewed, it's not data at all. I don't even like to look at it. It's frightening.
And I think Heather too, she's just worried about, children that have like racing heartbeats and that kind of thing. How does myocarditis and these problems manifest? Maybe if you could just, what are the symptoms?
Yeah, we always ask about shortness of breath, chest pain, palpitations, dizziness. Pre-syncope means like you feel like you're going to pass out. Syncope is you do pass out. Obviously, those would be very, very concerning symptoms. And that's on, when you go to get your sports physical with your doctor, if you've had COVID, they should be asking those questions. We ask those questions normally with a sports physical. And obviously, we want honest answers. If they do report one of those, that usually means then that we'll have to do further testing. There's a lot of heart tests that can be done, from an EKG to an echo to a cardiac MRI to troponin levels. And at the start of all this, a lot of those tests were being done. Then we realized we don't have to do cardiac MRIs on everybody that had COVID. If we did, our cardiologists would probably run off the face of the earth, because there's no way you can do a cardiac MRI on everybody that gets COVID. So symptoms are very, very, very important. In fact, that athlete I commented on earlier that had the multi-system anti-inflammatory or inflammatory syndrome, he was cleared appropriately, and then he became sick again. And fortunately, he did go to urgent care. He was appropriately worked up. He was held off the field and immediately tested, and they found out it wasn't myocarditis per se. It was this whole system overwhelmed with inflammation. And obviously, he was symptomatic. If he was trying to run around the field and was dropping because he's so short of breath, I would hope someone with some common sense would say, that's not normal. Let's go get that tested out. Palpitations are the feeling of skipped heartbeats. Some people don't know what they feel like. Many palpitations are totally benign, but if you have them, you ought to report it. Don't try to determine that yourself or do the Dr. Google and see if you can figure out what it's all about. That's not the way to be safe.
And Shelby, I do want to ask you, what will school nurses be looking for then in kids? Will it be just the basic, loss of smell, taste, fever, fatigue, or will they be diving deeper into some of those other symptoms when school starts and a kid comes into their office?
Yeah, our school nurses, because they had all last year to really get familiar with COVID and what that could look like. It looks different in so many different kids, age groups, all of that. So we really follow those guidelines that the county health department gives us on all the different symptoms. But then nurses just go with their intuition and their nursing assessment. And if something is off for this child, if it's something that's new or different, or just the child is just telling us they don't feel well, then we're going to ask that the parents get that checked out.
Jill, last question.
Oh my gosh, I am not going to do just one. I got to do two. I know the doctors have to get, but let me just tell you, we have to have you guys back because the questions are literally just flooding in. I'm going to pick a couple. Jennifer, yes, we will ask Dr. Pahud if on Thursday she can stay later because I know a lot of these questions are here. I want to have just a quick word for Ashley, who says, what about a child with increased heart rate, chest pain, shortness of breath, and dizziness that does not have myocarditis?
Well, that child needs to be checked out. Remember, we can't focus just on COVID. Medicine hasn't just narrowed down to one virus. We still have all the other things that can cause those symptoms, and that needs to be an immediate evaluation by their pediatrician or family physician, and if necessary, accessing a cardiologist, pediatric cardiologist or adult cardiologist. You don't ignore symptoms regardless. Even a rash that looks unusual to you. You don't just say, oh, well, it's probably okay. If you don't know, don't go looking at pictures on Google and stuff and trying to diagnose yourself. That's just not the way to do this. So get that child checked out. That would be very important.
Sounds good. Two real quick questions. Ashley, I want to give her peace of mind and also let her know that Dr. Alt is going to be on Friday at the top of the program. He's our OBGYN who's on the CDC ACIP committee. But Ashley says, I'm fully vaccinated 37-year-old woman who is 26 weeks pregnant. She wants to know, am I considered immune compromised just because I'm pregnant? Her husband has started going back to work and the people don't mask there. So she's worried about her and the baby.
Yeah. I mean, understandable to be concerned. You know, it's pregnancy is it can be scary. You know, especially amid COVID. So it's completely understandable to be nervous about that. You know, the vaccination is going to protect you and your baby a lot, and so I would definitely take heed in that. I would feel good about that. You know, I would encourage your husband, if he's at a workplace with folks that aren't masked, to do whatever he can to protect himself. But the vaccination, the main point for you is the vaccination is going to do a really good job protecting you and keeping your baby safe as well.
Yeah.
And one question each for the doctors. On Dr. Barr, can you have COVID and not have a fever?
Yes, absolutely.
Okay. And Dr. Smith, Gina wants to know, how accurate are the rapid tests, because they're doing it before her kids go to camp, and she wants to know, is that accurate?
You know, Dr. Barr is probably better the one to ask, because there are so many tests out there, and even the ones early on proved to be not always really accurate. But obviously, we talk a lot about the saliva test because it's so much easier to do than have that swab in your nose. I just guess what I would like to know, what test is it? Just because it's a test doesn't necessarily mean that you, again, throw caution to the wind, because I know there are a lot of summer camps this year that required testing before they went. And as I said earlier, okay, say it's negative and they get to camp, even if they're asymptomatic, you'd have to keep testing them about every other day to know for sure. And some camps were shut down because they'd have an index case and they had to quarantine the whole camp. So really find out who's giving the test. Is it reputable? I know Shelby mentioned the one that the KDHE now is helping the districts with, and I'm sure that KDHE has looked at the validity of that test, or they would not just fork over money and offer it to you if it's not a good test. So be careful. A test is a test. We have to take the whole picture, not just one test. So
I have so many, but I'm going to stop.
I know. I see you in there like going, okay, I got one, I got two, I got three. Okay, so just tell our friends watching that we will get our panel back on to answer their questions. So I think especially as we get closer and closer to school. So we will get you back on. But in the meantime, let's get our final thoughts. We do need to wrap up at some point. Dr. Smith, what are your final thoughts to the community? What do you want us to keep in mind today?
Well, first of all, thank you to all those that are asking these questions. That means we have real interest. That's what we need to do. We need to be interested. We need to get the data best we can. We need to be kind to one another and respectful in the way we handle this. But remember, as I said, sports are going to happen. The question is, are they going to start and keep going, or are they going to start and have to stop because someone perhaps is not doing what they need to do? We're in this together. We're a team. We're a community. We cannot be selfish. You know, I always taught my kids the golden rule: do unto others as you'd have them do unto you. If I knew that someone was out there coming to my workout facility sick, not masking or not washing hands and coming close to me, that's really upsetting, even though I'm vaccinated, because we don't know the person 6 feet from us. We don't know anything about their health. So let's play sports. Let's exercise. This is all really, really important stuff for us. And then back to the school thing, I'm so glad the Academy of Pediatrics says we want kids in school. That was a really rough year, Zooming in classes and for everybody. And so now let's get back in school. Let's get back in sports. Let's start to turn this around. It's going to take a lot of effort on all of our parts. But thank you again to all your questions. It was an excellent discussion today.
Thanks, Dr. Smith. And Shelby, just your final thoughts. And I think also just clear up, I think there's just kind of this tone that, you know, when schools get recommendations that they just automatically take them, that they don't have further decisions, that there's so many things that they have to look into before they just make a decision on behalf of thousands and thousands of children. Just kind of help us understand that what you have on your plate right now as we head into school.
Yeah, absolutely. So our district did a thought exchange with our parents of our elementary, middle, and high school to find out what are their thoughts. What do they want to see for mitigating measures? What do they want to do with masking? We also did a survey of our staff to find out what they wanted. We meet several times a week with the county health department. We talk with our partners all across the community, and then we meet as a leadership team. Our Board of Education is, extremely involved in these discussions and trying to determine what is best for our community. So there is a lot going on behind the scenes. There's a lot of people working really hard to get our kids in school and keep them there.
Thank you so much for coming on. We appreciate it. We would love to have you back on. Thanks, Shelby. Dr. Barr, final thoughts?
Yeah, to echo some of the thoughts and add a little bit more, I guess, right? So the first bit just being, wow, listen to that process that the school district is going through to try to put into place things to keep students and teachers, et cetera, safe. As parents, let's give a little faith to these folks. They're doing all this not to try to hurt your kid. They are strictly focused on trying to keep them safe. So if they're advising that we do masking, if they're saying, I think it's a really good idea to give a vaccine, let's meet that from a place of understanding, and let's meet it at a place that says they really care. They're doing this to try to help us, and have a little faith in them that they're doing that. The second point is to the broader community, and it's along the same lines. Have faith in the public health folks, have faith in the physicians and healthcare systems, nurses, everybody, that we are doing the same darn thing. I'm guarantee you not spending every hour I can reading papers about COVID, trying to understand every nitty-gritty part of it because I have some nefarious motive, as some misinformation stuff out there might imply. Not about me, I don't think I'm that famous, but maybe about Hawkinson or something. He's pretty famous. That just isn't the case. We are strictly, with physicians, we take oaths to do the best for our patients and try to save them. This is all we're doing. We really care about people trying to get through this. And so when I talk about vaccinations being safe and effective, it's not because I have some ulterior motive. It's because I want to keep people safe. That's it. And so I would really ask that if you're skeptical, just try to remember what our motives actually are. And our motives are absolutely to keep the community safe.
And you make a good point, Dr. Barr. Our final thoughts are never really that final, are they? We just
No.
always thinking.
No, my final thoughts will change when I read an article. In
Right,
10
we'll
minutes,
end this and then you'll have another final thought. And we will get back to that when you come back. So, all right, thank you to all of our guests. And thank you for joining us today. Okay, so tomorrow, he is back. It is Open Mics with Dr. Stites. And this is going to be a great show. And here's why. It has been 40 years since the start of the AIDS pandemic. He and his guests, who have lived through both pandemics now, talk about the history, how far we've come, and what we've learned. And later this week, we tackle another big topic a lot of you have been talking about, the Olympics. They kick off on Friday. Opening ceremonies just a few days away. But 2 KC area athletes are now quarantined, as we just talked about in Tokyo. We talk with 2 doctors who helped train some of these Olympic athletes on Friday. So you don't want to miss that. Make it a great one. And we will see you back here tomorrow, 8 a.m. sharp.